Hello everyone, this is Ryan, a premed student based in Australia, and in this channel, I hope to give all the international students out there some insights and some guidance in terms of applying to medical schools in Australia. If you have been following the channel, then you probably know I've made two ISAC videos prior to this video, and yeah, they are made in last year, so it's been a long time. So in today's video, I want to talk to I've asked my friend George to come on the Zoom call with me. And I'm going to ask him some questions about his experiences and his and some tips that he has for you guys in terms of applying to medical schools, and also any guidance, any insights would be really helpful. So because this video is conducted and filmed on Zoom, so the video quality and the audio quality would obviously be, how do I put it? It's not very nice, but I think you can still hear me and see me clearly, so that's all good. Without further ado, let's get into the chat. Hello George, how are you doing today?
Well, pretty nice. The weather is quite sunny in Shanghai at the moment.
So when are you coming to Australia? Anytime soon?
Well, I'm thinking the school will begin soon in late February, so I'm thinking of traveling in a week or so. So it's quite close, yeah.
Yeah, I'll look forward to seeing you in Australia. So let's just start with today's question. My first question for you is, why did you choose to study medicine? Why this particular field of science?
Well, for me, it's more about a family member's illness. My grandpa's, he has a stroke, which made him stay in bed for 10 years, which is quite sad, both for himself and also the family members, my dad, my mom, near him. And we spent quite a lot of money and time there. And it's more about the doctors and nursing and also caring professionals show how cared for my grandpa. So doctors is very rewarding career. That's not only the pay is quite nice, and also you get to help people. It's more like a personal interact. That sort of very much, I'm outgoing person, so I'm very much looking forward to that. Yeah.
So I know you did your high school studies based in the UK. So why did you choose doing medicine in Australia over doing medicine in the UK? What are some advantages that you want to talk about?
Well, I have seniors studying in UK medical school, and what I heard from them is, after graduating from UK's high school, they have quite a lot of friends actually practicing in Australia instead, not only because of the nice weather, friendly people, and also the pay was actually far more than the UK. Probably there's 50% to 100% increase of the salary. So they opt for Australia, because of that.
I know the UK health system is, it's sometimes a bit understaffed and doctors work very long hours. Is that also the case in Australia, from what you heard from your friends?
Well, what I heard from them is, because of COVID, of course, the one is quite understaffed, but it seems to be a bit better than the UK ones, because regarding the beds in the intensive care unit, and also beds in general and doctors to general populations, Australia seems to be a much better situation than the UK ones. Yeah.
So let's move on to the next topic, which is everyone's favorite, the ISAT, right? The International Student Aptitude Test. So how did you find the ISAT in terms of difficulty?
Well, since I have sort of experience preparing for my UCAT, which I did achieve full marks in quantitative reasoning and also abstract reasoning.
Yeah, that's just blows my mind. Like that abstract reasoning is just out of my it's beyond my abilities.
Yeah, so for ISAT's quantitative reasoning part, I find out quite straightforward, so I didn't spend much time preparing for that. But since English is my second language, I find critical thinking part was sort of not much a big problem, but I spent quite some time on those, trying to get used to the question. And the most important part is getting the right part and getting the marks. Yeah.
Yeah, and I think for critical is also the part where I kind of stopped on. The worst type of question in critical would be like the quotes analysis type of question. I don't know if you've seen it in your ISAT. It's where it gives you a quote from someone you've never heard of and then asking you the meaning of it, or like compare different quotes. So would you say that is the sort of the biggest challenge of the critical reasoning component of the ISAT?
Yeah, because the quote part is usually quite short, and sometimes if there's a word, like a typical words I don't understand, which is very, very important to answer the questions, then boom, that question is also
so
an answer,
I think
sadly.
I skipped I sort of just guessed and skipped quite a few close questions, and that was a pain in the ass.
Yeah, definitely.
Roughly, like, how many months or weeks did you start preparing for the ISAT?
Ooh, then let me just count. I think because I took my ISAT in late May, and it was sort of clashing with my A-level marks. So let me think. I think probably a month or so, give or take. And for the first 1 or 2 weeks, it's mainly just getting to know the question about more general parts. And then for the last few, I think 2 to 3 weeks, then I just dig and deep into the question bank and trying to get myself used to the questions and how I answer it in a more like speedy manner as well as a correct manner. Yeah. I was preparing for UCAT was the Medify, which have like 10,000 questions there. I find it quite useful. Then when it comes to ISAT, there's not much resource online. And all of a sudden I bump into Ryan's video on YouTube, and he talks about how he achieved so highly on ISAT. I was like, this guy knows the stuff. So I asked him whether he had any resource, and he kindly offers me the question bank, which is like kindly picked and made. And I find really useful with that question bank. Yeah.
Well, thank you for your kindness. And I wouldn't say that luck is not a component for my ISAT success, but definitely I think just trying to get your hands on any practice questions will be good, because for an aptitude test, there is really not much theory to be learned. There's really not much knowledge-based kind of stuff. It's more to do with how would you approach this question and what's the most efficient way of solving this question, and that naturally that you can naturally improve that by doing more practice questions. And that's how I found it as well.
I think most importantly for me, like if you did the question bank, the most important part is also you look back into the question which you get wrong with, and you clearly understand why you didn't pick the like right answers, and that helps you improving. And then with the more question you do, you sort of get to know the pattern well, then you sort of get the correctness percentage up, and you mastered it. Yeah,
exactly. That's how I did it as well, because obviously I did a lot of questions because I had more time compared to you to prepare for the ISAT. And also just redoing my mistake questions and sort of compiling the common mistake I make. I think about what are some strategies I can do to avoid making the same mistakes in the future. And I think going through the mistake questions, really understanding what the question is testing you on. Like some of them is, obviously you need to know whether this question is critical or quantitative, and then sort of have a targeted technique or targeted strategy for each type of question would be really helpful.
Yeah, like previously we mentioned about the quote question, then there's strategy for that. And for other like criteria of critical thinking part, then there's also other techniques. For example, some are quite long. You have to spend some time perhaps reading the options first, then looking back to the answers.
All right, so let's move on to interview. So for those of you who don't know, George is our interview instructor, and he has extensive interview experience in not only just Australian medical schools, but also in the UK. So What do you think? My first question for you is, what do you think is the main difference between a multiple mini interview, an MMI, and a panel interview?
Well, I think for my own experience, MMI is more like a station, as recording the name, and it's quick and fast. That's if you did well in that section, wow, that's pretty nice. Then keep on the good work. But if you did badly, unfortunately, on that sections, take a deep breath, then you're ready to go for the next one. And each instructors will give you really interesting and not related questions regarding your core attributes. And I think it's more like a straightforward questions for that stations, and quite like that. For the panel one, it's more different style. The first impression is really important because you have a group of interviewers. There are medical students, doctors, professors there, and you try to impress them. And when the interview session is leading deep on, then they will give you difficult questions and they will get to know you as a whole person. Then they will assess you whether you're suitable for medicine. And that's for the panel interviews. Yeah.
So it sounds like for multiple mini interview is more like different stations you go into, and then most of which would be ethics related questions. Is that correct for multiple mini interview?
Yeah, it's more like a situational judgment.
Situational judgment.
Yeah, what you should do on that one. And also like MMI has a quite strict time limited. Mm-hmm. And panel is more like the panel themselves control about the timing. Yeah. So you're quite open to the time. Yeah.
Okay. So can you briefly talk about how you prepared for the interview? And also that includes MMI?
Well, personally, I have a question bank I find online and which I find quite useful. Then they have some sample and typical answers, but I don't kind of time to follow them. I write myself my own bullet point, which is tailor-made to myself regarding my experience, my extracurricular activities that I tend to practice with my friends, or sometimes I just record a video of myself and look back into that to see whether I made clear points, whether I get the point to have impress interviewers. And those kind of find it quite useful, yeah.
So it's sort of like you go through a question bank, you write on dot points about, how would you answer each type of question, and going to the interview room, then you feel more confident and you have, prepared for this, and also you have something to talk about.
Yeah.
I'm also curious, what are some commonly asked questions in medical interview, and how would you lead students to interview success?
Well, on top of my head, I have a very typical one, an ethical one. It's about kidney transplantation that my teachers gave me as an example. I'll show it to you guys, but I won't give you the answer. Have a quite big think about it. So if you are a medical profession, then there's a kidney available. Sorry, that's my Apple Watch. Yeah, there's a kidney available to you, and there's a two patients waiting for the kidney transplant. One is a drug addicted who thankfully get rid of his drug addictions, but has done quite a lot of criminal stuff. And he's a teenager, juvenile. And the other one is a 30 or 40-year-old teacher who just had 2 newborn babies and have a really lovely family out there. And if you are the medical profession, like, what are you gonna choose? Like, that kidney only has one, you're only gonna pick one, and perhaps it means that if you pick that person, the other person may die because of that. Then it's really hard choice, to be honest. And what will you do regarding that situation?
Yeah, that's a really hard situation. I don't know. It's like, because you have one kidney and basically you are in control of 2 people's lives, and it's really about how you can justify your decision, and and in an ethical and non-biased way of doing things. Really.
Yeah.
Okay, so
I mean,
everyone think about that question. It's a pretty tricky question. Yeah.
yeah, when I was shadowing my doctors, especially in the emergency department, like
Mhm.
life and death decision was kind of just within a minute, and you have to think properly. Yeah, and also a small hint, perhaps if you have heard of autonomy, which is the patient's own like needs and their own thinking.
Yep.
Beneficence is doing good to the patient, and
Right.
non-maleficence is do no harm to the patient.
Right.
While justice is about not only the patients but also in the general public how the resource and also the money used to the patient may treat well for them. Yeah.
Yeah. Definitely a good way to start thinking about these questions more critically. Yeah, getting into the habit of, just thinking about those questions and how would you justify your decision. All right,
Yeah.
so moving on, because you're our interview instructor and you did extremely well in so many interviews, not only in Australia but also in the UK. So how would you lead students to interview success?
So obviously I designed our interview course. I was thinking that giving students a pre-filled form so I could get to know you as a person regarding your academia, also extracurricular activities, your core attributes, your examples regarding those. So it's more like a tailor-made sessions to you. Then we'll have probably half an hour talk regarding that form. And I will also look into the schools that you're applying for. For example, Monash University, they have a MMI, while New South Wales sort of have a machine gun, 30 minutes, 30 questions.
Yeah, that's why.
While U Sydney has more like a written assessment than was a group interview. So every school has their different strategies, and I have to tailor-make the interview session just for you. Yeah. And I think really mock interviews are quite important, which will involve in several sessions. And
Yeah.
I'll provide you with comprehensive feedbacks on what you did well on and what you can work on. And hopefully that will get you into medical school in the end. Yeah.
Yeah, because it's really the last step. And like, if you got an interview offer, that means you probably have a 50% chance of getting into uni, right? So you don't really want to stuff up on the last step because, yeah, it's dreadful, but it's definitely something that you can prepare for. Okay, so moving on to the next topic, because we just talked about different schools, UNSW, Monash. Could you please provide some information about the different entry requirements for the different universities?
Well, yeah, different universities are quite different. So, for example, Adelaide, they need the UK ANZ for international students as well. Or for Monash, New South Wales, those two. And perhaps I think UQ needs an ISAT for international student. Well, you Sydney just purely look at your ATAR or A-level. And Monash, it's more like a cert for different criteria. So a cert of your ATAR, a cert of your admission assessment, a cert of interviewers. So if you did sort of not so well in one of the sections, then the other two can compensate, hopefully, the other two.
Yeah.
Which is quite useful, yeah.
Yeah, so that's for Monash. And also, I have friends who did apply to JCU, James Cook University, and also University of Tasmania, Flinders. Those universities are quite similar in a way that they also all of them require the ISAT. I think Flinders just stopped doing that last year, so they don't actually require the ISAT anymore. But for JCU, even Newcastle University, University of Newcastle, I think, and also what's the other one? UTAS, University of Tasmania. All of them requires the ISAT, and sort of that's the ISAT score plus your high school results gives you a chance to get interviewed by those universities.
Yeah. I think also like one important part of picking uni is more like, for example, Western Australia and Sydney and also Melbourne and also Queensland. I think those four are the ones you get into undergrad first. then
Yeah.
4 years of MD or DMD. Well, for the other Monash, Flinders, and also New South Wales, they're more like you get straight into medicine for 5 or 6 years.
Yeah, but I think you still graduate with an MD degree. It's just
Yeah.
you don't need to, for all these pathways, you just don't need to sit the dread for, I don't know how long, is this 6 hours, GAMSAT?
I'm not really sure, but I
Yeah,
think
but
give
it's
or
like,
take, yeah.
yeah, it's a painful exam. So interestingly, you got an offer from Monash and also from University of Sydney. Why did you ultimately choose University of Sydney over Monash?
Well, for me, it's quite a hard choice to both me and my family regarding the money and also the years. I think the major reason I choose U Sydney is not only because it's well-known international research, but also I have a more like a easy undergrad like lifestyle. Regarding that, I meant I'm sort of guaranteed to do an MD program, so I have time to make myself mature enough to medical school, and also have more time to do those researches, and also getting to know friends, join clubs. And because I heard my friends who step into medical school, they find a very big transition from high school to medical schools, and some of them just can't handle the stress given to them.
So an easy 3 years of undergrad just means you have a more painful 4-year postgrad of MD, right? Because they're basically compressing everything down from 5 or 6 years down to 4 years. Yeah, but I think the point that you raised is interesting in terms of research, finding like what your passion is. I think so those are the unique advantages offered by having an undergrad course first, and then you do a postgrad.
And for me in U Sydney, I major in neuroscience and also data science. And I think data science is something, if I went straight into medical school, that I will probably not even touch for that. But as the international world today, we're like sort of data-driven database, evidence-based medicine. That's quite important to have those skills, and you have a university to structurally teach you how you do that. I think it will become handy in the near future.
It definitely will. So I know you are still in Shanghai, but how do you feel of going into medical school as an international student?
Well, I'm definitely quite excited because after 7 years, I've become a medical profession and be able to help people. And I also have attended the offer holder session for University of Sydney and as well as Monash. And I feel they gave me a sense of a very welcoming international student, and they have a supportive international group regarding us. For example, in Monash, they have a group of Singaporean students, Malaysian students, Canadians there just to help you with. And in U Sydney, it's even better because for our coma, it's a very small group. I think only 40 people are there. So you have mentors from the seniors. Overall, I think like it's really a supportive environment for medical students. I'm really looking forward to join them.
And definitely because of the amount of money we're paying to go to this medical schools, that it's definitely worth it. My last question for you today is, where do you see yourself in 10 years?
I have to think about it for a second, because obviously, U Sydney has 7 years of school that leaves me sort of it's all planned. And I'm not really sure where I'll be practicing. Like after I graduate, I was looking into options also in the States as well. So for them, you need USMLE. And if I'm staying in Australia, then it's obviously a year of internship and 2 years of residency. And I'm hoping to get into the very rewarding surgical program and very hard to get in one as well.
And you also talked about practicing overseas, right? Going to the US, even going back to UK, right? So those are all the possibilities you can have. But in the UK, do you have another exam you need to take in order to practice medicine there?
I think it's more straightforward. It's called P-Lab, I think. but it just like when you graduate from Australian medical school, it's a straightforward test. You just did it. Yeah.
Yeah. Okay. So endless possibilities, and doctors are always a needed profession in the 21st century. All right. So thank you for your time today, George. Really lovely chatting with you.
Yeah, definitely. And hope you have a really nice day, I guess.
Yeah. I'll see you in Australia when you come to Sydney. All right. And definitely come visit Melbourne as well. But Melbourne weather is pretty miserable. It's like the UK. It's
Oh yeah, can't mention UK's weather. It's horrible out there. I'm hoping the beautiful sunshine in Sydney and also the beaches. Yeah.
Definitely remember to put on sunscreen, because the UV here is quite scary. It's going to give you skin cancer if you don't put on any sunscreen. Okay, lovely chatting with you. I'll see you next time. Bye-bye.
Bye.